So being intimate doesn't just mean being sexually intimate, right? People may think that, okay, I can just have sex to have the goal of having a baby, but over time you might find that just focusing on that one goal while you neglect other areas of intimacy, such as being physically intimate, emotionally affectionate, staying connected intellectually and in other ways, your sexual relationship will suffer as well. And of course, in the long run, that will affect the chances of conceiving. What you mentioned just now, I mean, all Singaporeans, we're so busy, right? So we know we want to have the goal of having a baby, so a lot of couples actually focus on sex during the fertile period, which is fair enough, right? But then over time, it becomes a pressure for both the husband and wife. For the wife, because it becomes a little bit of a chore, they may suffer from some dryness. Sex is not so pleasurable. For the men as well. I mean, of course, like you said, they get the message saying, hey, tonight, you gotta, get in here. And over time, sometimes they can suffer from some, difficulties maintaining the erection as well. So the sexual relationship of the couple can suffer in the long run. It's very common. It may not be a permanent thing, but that's something that we commonly see. And as doctors, we sometimes also are, may be a cause of causing the sexual health to suffer a little bit as a result of our very detailed instructions. I think it's very difficult to just tell yourself that I'm having sex just for fun, because your body knows that what you're trying for is baby after time and time again. But I think the first thing is to communicate to each other clearly. And the other thing is not to feel down, let's say, on sometimes when you're trying for baby, you're not able to so-called make it for that, that day that you're supposed to be making a baby. Don't get yourself so down. You don't have to have this intercourse perfectly every single time during the ovulation period. That's one thing. The other thing is that maybe outside of the fertile period, give yourself a break. So I mean, just having fun, connecting on non-sexual levels, that can actually help to maintain the relationship. Definitely arousal, getting, focusing on what's arousing for you. That would be something that's what would actually help.
It's a very common, topic actually amongst women. So cysts are actually very common. They are fluid-filled sacs in the ovaries. Most of them are actually related to your menstrual cycle. So they're what we call functional cysts or physiological cysts, whereby they actually disappear or resolve on their own after a few menstrual cycles. But of course, some of them, they do persist, and those are what we call, for example, dermoid cysts. And they are formed from the reproductive cells of the ovaries. So dermoid cysts, they can even contain things like oil glands, even tissue like hair as well as teeth sometimes, and those can grow bigger and will require monitoring or even surgical management. And of course, endometriotic cysts, this is a very big and hot topic right now, especially for fertility. So endometriotic cysts are actually formed from the lining of the uterus. So some of it has gone onto the ovaries to form cysts on the ovaries itself. So in a nutshell, in general, this is what cysts are. Okay, fibroids are actually benign growths of the muscle of the uterus. They're very, very common. Maybe about 40% of women actually have fibroids. Most of them, women do not even know that they have fibroids until they've done an ultrasound scan for other reasons, and they pick it up incidentally. They may not have any symptoms, and they may also be at different locations on the uterus, causing different types of symptoms. But generally, the idea is that they are benign, meaning they are non-cancerous. The other topic is polycystic ovarian syndrome. It is the result probably of imbalance of hormones. Very common as well, 10 to 15% of women have it. Some of the common symptoms would include things like increased hair growth, acne, irregular menstruation, or some women do not even have menses with PCOS. And of course, that will also affect your fertility if you don't have menses and you're not ovulating. In the long run as well, PCOS does have consequences to the cardiovascular health. So a woman with PCOS may have a higher risk of getting things like diabetes and high blood pressure in the future. So it's really important to actually treat women and educate them about their condition so they know how to manage it better. Most cysts, if they are functional or they're part of your menstrual cycle, they can be quite small. They may not have any symptoms at all. And like I say, you pick them up incidentally on an ultrasound scan. But if they are very large, they can actually cause symptoms. So you may experience things like feeling a fullness in your pelvis, some pressure, abdominal pain. And for some women, if the cyst is very large, it can actually twist around its blood supply and cause an emergency called ovarian torsion, where there will be a very sudden, severe pain in the abdomen, which is accompanied by nausea and vomiting. So these are some of the symptoms that a cyst can produce. For fibroids, of course, if they're large, then they can also produce pressure in your pelvis. If they are located sort of anteriorly in the front of the uterus, then they can actually press onto the bladder and cause problems with passing urine. If they're at the back, they can cause problems with passing motion as well. And if they're located near the lining of the uterus or pressing on the lining of the uterus, then they can cause things like heavy menstrual bleeding, for example. So for cysts, if they are functional and they're small, then they wouldn't affect your fertility at all. However, of course, if you have a particular cyst called endometriosis, then that is something that will potentially affect your fertility because it does cause some anatomical distortions because of the inflammation response that your body produces when you have endometriosis. This can affect your, say, implantation. It can affect your egg quality as well. And for some women, because endometriosis can even cause dilated tubes and blocked tubes as well. So it can affect your fertility, although that said, maybe 60% of women with endometriosis, they're able to get pregnant on their own as well. It's really important that, even if you have this condition, to not give up hope, and you can still try and get pregnant on your own. And what I would suggest would probably be to actually try having sex regularly, at least for 6 months. And if you have any problems, then you can seek advice from a fertility specialist. So usually you pick that up actually in pregnancy itself, when they do scans of the cervix to measure the length of the cervix, and that's when they pick it up. We don't really use the word incompetent cervix these days because it's not something that we usually say. But if you have a pregnancy whereby you have a shortened cervix, in the next pregnancy you can speak to your gynecologist whether you need to do any stitching of the cervix in the earlier part of pregnancy. Or you could actually get some progesterone tablets as well in the earlier part of pregnancy.
I think before we know what the problems are, let's have an idea of what men need to do before they can conceive. First, you must be able to have a good enough erection. Then you need to be able to ejaculate. And then within the ejaculate, you must have enough good quality sperm. So what problems can arise then? Erection problems such as erectile dysfunction, or what we commonly known as impotence, can affect people with erectile dysfunction. It's hard even to have regular sexual intercourse. And of course, we go on to ejaculatory disorders. Some men have premature ejaculation. Some men have retrograde ejaculation. Retrograde ejaculation is a very not so common condition, but this happens where during ejaculation, the sperm actually goes backward and goes into the bladder and get mixed with the urine. And so you can imagine how with that trajectory path, the sperm is not able to travel into the lady, into the uterus to reach the egg. And of course, we go on to the sperm issues. How do you actually know you have a sperm issue? Usually, it is picked up by having a semen analysis, a sperm test, as what is commonly known. And within the sperm test, there are 4 important parameters that we look at to determine whether or not this sperm sample is good enough. So first, you must have enough volume of ejaculate. Then you must have enough density. Density is the measure of how many sperm present within 1 milliliter of ejaculate. Then the next would be the motility. Motility refers to how many % of your sperm are fast swimmers. You can imagine the sperm needs to travel a long journey to reach the egg, given that how small the sperm is, and that they have to go through many obstacles. So a fast swimmer is definitely one that gives you a better chance of reaching the egg and meeting and fertilizing the egg. And of course, the last would be morphology, which is commonly known as how many percent of your sperm having normal or abnormal shape. And you'll be surprised to know that actually the vast majority of your sperm are shaped abnormally, at least according to the WHO criteria, and that for WHO to term you to have a normal morphology, you must have at least 4% of all your sperm looking and fitting the criteria of normal. So in general, these are the things that men face when they realize that they don't have or they're not able to conceive within a certain period of time. We look at the age of the woman to decide whether or not how long you are considered to be having problems. So if the lady is less than 35 years old with no other significant conditions such as what Dr. Lim has mentioned before, and with 1 full year of regularly trying, I'm talking about having sex once every 2 to 3 days whenever you're not having the period, then and you're not able to conceive, then you should be getting yourself checked, both the man and the lady. And if you're more than 35 years old and with regular sexual intercourse, within 6 months with no results, I think it's fair to say that you should get yourself checked and to see if there's any issues. Of course, if you're having things like irregular periods, known fibroids, or if the man has got problems with ejaculation or erection, don't wait till the stipulated time to get help. Please just come and see us early so that we can at least have an idea of what we're dealing with, and we can provide the appropriate remedy. So I guess we are talking about improving or optimizing your natural fertility. We always must look at improving our general health right off the bat, because things like obesity, diabetes, hypertension, these are conditions that can affect not just the quality and the quantity of the sperm, it can affect erection or ejaculatory functions of the men. And of course, regular exercising, avoidance of bad habits such as smoking or heavy drinking, and of course there are some occupational hazards, I guess, that one can't avoid but should try to reduce. If you are constantly under the hot sun, if you are constantly riding a vehicle, you should try to find ways and means to keep your lower regions cool, because a higher temperature can give rise to reduced sperm count and quality. I get this a lot in the clinic. Tight underwear, definitely no go for you if you are trying for pregnancy. Why? Because the tight underwear will keep your testicles very close to your skin and the rest of the body, and that will give rise to a higher scrotal temperature, and we don't want that. The temperature of your genitals should be kept a few degrees lower than your core body temperature. That's the whole reason why a man's testicles are situated away from the body. So I guess briefs and boxers should be optimal for you if you are trying for pregnancy. If you have any of the issues, right, not being able to have a firm enough erection, or you think that you're not able to ejaculate properly during sexual intercourse, or if you're just trying for some time and not being able to get pregnant, you can seek help with any of the fertility specialists or your gynecologist. They will advise you on where to get your sperm test done, or if need be, see the specialists in the general hospitals who deals with erection disorders or ejaculation disorders.
There is no best time. So the best time is now. So when you are physically and emotionally ready after a miscarriage, you can always try. So traditionally, people always say you need to wait 6 months or a year before you try again, but recent data shows that this is not true. So as long as you have fully recovered from the miscarriage and as long as you are healthy physically and emotionally, should be the best time. We say this because the woman's age is important in fertility as well as to calculate the risk of miscarriage. So the older we are, the higher the risk of miscarriage. So that some people will think maybe I will try in March so that I will get a baby in this month. But life doesn't happen that way. And sometimes if it doesn't happen, then we will celebrate our next birthday. So it's always good to try as soon as possible whenever you're ready. Pregnancies don't always work out well. So 25% of all pregnancies actually end up with miscarriages, whether you have a problem, medical problem, or you're perfectly healthy. So I think you should go in with a positive mindset. It's always very helpful to you, your partner, and your family around you. You cannot control things you cannot control. Most of the miscarriages will happen because the pregnancy has an abnormal DNA. So this is not within your control. So it happens because when the egg or the sperm splits into two, the DNA becomes unbalanced and then they result in a pregnancy, but the pregnancy is not healthy. That's why it doesn't continue. However, you really can't prepare yourself for that. So you should just try to get pregnant and be as healthy as you can be and think positively. I think that will be the most helpful. One question, like is it the things I do or didn't do that affect whether I can get pregnant or whether the pregnancy will work out? There's a lot of self-blame and self-doubt, especially in a woman. So you need to know, okay, it is not your fault. You didn't do anything and there's nothing you can do if the pregnancy doesn't work out because really is not within your control. By blaming yourself is very unnecessary because it makes yourself very stressful. But this is very inherent to us women. So as a man, okay, to prepare yourself emotionally, I always encourage the man to be supportive. We do neglect the man sometimes. I mean, during fertility and during a pregnancy loss, we always think that the men are okay, but actually they are not okay. They also feel sad and they feel devastated, but they cannot maybe show as much as a woman can. But what you can do to help your wife is you can show her that you are also sad. You can show her that you are also supportive. And if you have a strong and healthy relationship, it helps with getting pregnant, it helps with overcoming a loss, it helps with moving on with your life. Fertility is usually not affected after a miscarriage. As long as you are healthy and as long as you have controlled your medical conditions, you should just try to get pregnant. However, very rarely if the pregnancy loss is so significant, like if you have a very severe infection or something that very rarely occurs, it might affect your fertility. But you cannot go away thinking that, oh, the worst is going to happen to me. I'm going to have scarring of the womb because I had a miscarriage, that's why I cannot get pregnant. I think you should not overthink. You should try to get pregnant, and if we have a problem eventually, we will deal with it. But this is very rare. Most of the time, a miscarriage is a one-off event, and your next pregnancy is usually going to be successful. Specific to scarring, it is the same. Having a termination or evacuation for miscarriage, there is no difference, but the reason is different. So if you have recurrent miscarriages, then we are not just dealing with scarring of the womb lining. We want to think about, is there anything other that is contributing to the repeated miscarriages? So this is not common by chance. So if you have one miscarriage, it's probably by chance. But if you have 3 or more miscarriages, the chance of you having it based on luck alone is about 0.00%, but yet we know that 1 to 2% of women do suffer from recurrent miscarriages. So if you have repeated miscarriages, my advice is you should see a gynecologist to do some tests to see if there's any other thing that we can deal with before we get pregnant again.